there's an effort in this country right now to take a wrecking ball to access to health care. And for reasons that I will never understand, I've been in politics for a long time, I have seen many political battles. I do not understand the obsession with trying to kick tens of millions of people off health care. The obsession with destroying the Affordable Care Act, the obsession with making massive cuts to Medicaid, so that the 1 in 3 Californians, 1 in 2 children in California who are on Medi-Cal will lose access to at least some health care. I don't understand it, but that's the reality that we face. But this is yet another example of why it's so important to win the fight for access to health care. When mothers, expectant mothers, are able to have great care during their pregnancy, are able to be healthy and give birth to a healthy child, it makes it better for everyone. And that family's going to be better off, the community's going to be better off, the kid is going to be better off. So let's keep working for universal health care. Thank you.
The fact that it's normal, even in this day and age, for many of the women of the African American community to not seek out prenatal care is scary. And so I applaud UCSF for having the foresight to look at the data and to look at solutions and to fund this incredible program that is going to really target the communities that we know need this support the most. I'm excited about the hospital that's going to be made available, the research, the support, all of the things that are necessary in order to make sure that we do exactly as Dr. Rand has said, roll back the clock and make gains around this particular issue, similarly to how we have made incredible gains around the AIDS crisis back in the 1980s. So we can look back in the next 10 years and think, wow, this initiative helped start something that has changed those numbers, that have changed the data.
I came to this work as a member 7 years ago, representing the Southeast neighborhoods of Bayview, Hunters Point, Potrero Hill, Visitation Valley. And there was an interesting article that ran in the Chronicle about 8 years ago that talked about the health disparities, the likelihood that a black man would not live as long as someone who lived in Nob Hill. And unfortunately, that statistic still remains the same 8 years later. I became familiar with preterm birth, low birth rates through the Black Infant Health Project, which is home in District 10 in the Fillmore. And as I began to familiarize myself with a lot of the issues, I've been trying to figure out what exactly are the outcomes that we can see immediately. So I'm chair of the budget committee, and so my priorities have always been to fund organizations, to support organizations, to ensure that we are fully funding these health initiatives so that they begin to turn around the outcomes, so that young children, before they're even born, have a real fighting chance.